Hello, my name is Dr. Hillel Mazansky, and I specialize in medical hypnotherapy, guided visualization, nutrition, and exercise. My website being drmedicalhypnosis.com. That's drmedicalhypnosis.com. Today's health tip is entitled, What's Causing My Headache? Headache is a huge problem in as much as that the vast majority of people have headaches occasionally. But when the headaches become persistent, then it's a little more challenging. Now, there are various types of headaches. The so-called muscle tension headache, which is the most common type of headache that we see beginning in the neck and radiating up from the neck up into the skull and goes to the shoulders. The next most common is, of course, migraine headache, which can sometimes be severe and recurrent. Cluster headaches is a type of headache that comes mainly in men, and it's a type of migraine headache that keeps on persisting daily for 4, 5, 6 days. Every day is a headache, and then the patients are free of headaches for some months, and then suddenly they get a cluster again. Surprisingly enough, the best treatment for a cluster headache is to take pure oxygen, inhale oxygen. The next type of headache is called the so-called ice cream headache or brain freeze. When you eat the very cold ice cream, all of a sudden you get this intense headache for a while, and then it subsides. If you do get that headache, just drink something warm and the headache will dissipate. Sinus headaches are always accompanied by symptoms of upper respiratory infection, whether runny nose or cough, and it's more of a facial type headache rather than the headache that's at the back of your head. The sinus headache, most people have had it. And that's usually treated with some analgesic medication. Very rarely is an antibiotic needed. The next one is called the sex headache. Yes, don't laugh. Some people have, when they have sex, especially the females, have quite a headache after that. And it's well known. There's nothing that one can do. The headache will just disappear by itself. But it is a well-known type of headache. When people have headaches, you must be very careful not to over-medicate yourself. Because if you over-medicate, you can continue getting the headaches, and it's called a rebound headache. That you take the medication and then keeps on rebounding, and you develop a vicious cycle. So you must not have too much medication. This is particularly true in patients who suffer migraine. Well, with migraine headaches, we've spoken about that before. You get an intense headache on one or other side of your head. You can get the aura, where you get flashing lights, or you hear abnormal sounds, and then the headache develops. It's associated with nausea and vomiting, and it can be quite intense. We've discussed migraines before. Then if you get a sudden onset of a headache, and it's associated with nausea and vomiting, or any tingling in the arms and legs, you must go immediately to the emergency room, because this can indicate meningitis, which can be severe diagnostic problem and has some severe consequences. One does not usually need to have a CAT scan or an MRI scan if one has headaches. The diagnosis of the headache is made on a careful history taken by the physician or the healthcare provider. The examinations usually don't show much, except sometimes in a spasm in the neck might occur in a tension headache. but one quickly wants to wants to have an MRI because they think they have a tumor that's causing the headache. Well, that is false. Tumors do not give headaches, they present with neurological deficits. When something neurologically is wrong with you, whether you feel some weakness or some difficulty with walking or some other neurological symptom, that's how brain tumors appear, not with a headache. So don't think that every headache that you get is a brain tumor and you run off to the doctor to get it. It's not true. The other type of headache that is can be of concern is if you're hit or knocked on the head, you can have what is called a subdural hemorrhage, where a little vessel bursts in the brain and you can bleed in the brain. Now that can be more challenging and more severe, but that usually begins after a history of injury, whether it's on the football field or sport, or where you sustain an injury to the neck. Then those types of headaches need urgent treatment. But by and large, one does not need heavy medication. If, however, you get recurrent migraine headaches or so-called muscle tension headaches, which are usually stress-related, then medical hypnosis can help you a great deal. A, for the stress, if it is a stress-type headache, or B, if it's migraine, hypnosis helps prevent the attack, and when the attack occurs, it can actually shorten the attack. On our website, drmedicalhypnosis.com, there are videos available for those who suffer muscle tension headaches with stress and migraine headaches. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.